Hello student, good morning all of you. I hope you all are fine. I Neeraj Khare as a biology teacher of class ninth. So dear student, we start for the revision for chapter 13. Why do we fall ill? Why do you fall ill? So first one is start the health. Health is a state of being well enough to function well physically, mentally and socially. Health is a state of being well enough to function well physically, mentally, and socially. Second one, disease. Disease disease means disease means being the uncomfortable one or mood system of the body will change, give rise to symptoms, cough, loose motion, push formation, headache, fever, breathless, vomiting, fits. So, dear student, disease distributed case means being the uncomfortable one or more system of the body will change, give rise to symptoms, cough, loose motion, push formation, headache, fever, breathlessness, and vomiting fits. Unconscious inflammation, swelling, and general effect, a doctor look for the basis of the symptoms. So disease are the basically two types: acute disease and chronic disease. So, dear student, unconscious inflammations, swelling, and journal effect, a doctor look for the basis of symptoms. So disease are basically two types: acute disease and chronic disease. Third one, the acute disease, the disease which lasts for any the disease which lasts for only a short period of time is called acute disease. Examples: common cold and chronic disease, the disease which lasts for a long period of the time is called chronic disease. As an example of tuberculosis. So dear student, acute disease and chronic disease. So acute disease, the disease which lasts for only a short period of time is called acute disease. Disease examples: common cold, and a chronic disease, the disease which lasts for a long period of the time is called chronic disease. Example of tuberculosis. Acute disease and chronic disease. Acute disease, there are short duration disease. Chronic disease, these are the long lasting disease, and patient recover the completely after the care. The patient does not recover completely. Third one is there is no loss of weight of feeling to traditions upward, and there is the often a loss of the weight of the feeling of traditionals. There is short durations, loss of work and inefficiency. There is the prolonged loss of work and efficiency. So, dear student, acute disease and chronic disease. Case of disease. Dear student, case of disease. Most of the disease have many cases. Cases of disease. Most of the disease have many cases rather than one single cases, like unclean water, seed, genetic deficiency, genetic abnormalities. Example based on the case, disease are of two type: non-infectious disease and infectious disease. Non-infectious disease and infected disease. So dear students, case of the disease, most of the disease have many cases. Many cases rather than one single cases, like unclean water, neuromeats, genetic difference, genetic abnormalities. Example based of the cases disease are of two type: non-infectious disease and infectious disease. Non-infectious disease, not caused by the infectious agent, mostly internal and non-infectious case. Example cancer. Non-infectious disease not caused by the infectious agents, mostly internal and the non-infectious cases. Example cancer. Infectious disease caused by the infection agent. Infectious disease caused by infectious agent. Principle of treatment. Principle of treatment. Antibiotics. First one, antibiotics. Many bacteria make a cell wall to protect themselves. The antibiotic penicillin blocks the bacterial process that wilds cell wall and the block the biological pathway. Antibiotics do not work agent viral infections. So, dear students, principle of treatment. First one is the antibiotics. Many bacteria make a cell wall to protect themselves. The antibiotic penicillin blocks the bacterial process that builds cell wall and the block the bio, biomechanical pathway. Antibiotics do not work agent viral infections. Antiviral medicines is the harder than making the antibacterial medicine because virus has only few biochemical mechanism of their own. Other medicines bring down, favor the reduce the pain or lose motions. We can take bed rest to conserve the energy 80%. And principle of the prevention. Following three limitations are normally comfortant while the treating and the infectious disease. When some has disease, their body functions are damaged and may never recover completely. So, dear students, principle of prevention. Following three limitations are the normally comfortant and while the treating an infectious disease. First one is once some has disease, their body functions are damaged and may never recover completely. Treatment will take time, which means that the someone suffering from a disease is likely to be ridden for the some time even if we can give proper treatment. So treatment will take time, which means that someone suffering from the disease is likely to be ridden from some time even if we can give proper treatment. The person suffering from and the infectious disease can serve as the sources from where the infection may be separate to other people. So, dear student, the person suffering from and the infectious disease can serve as the sources from where the infections may spread to other people. So, dear student, today's chapter is complete. So, I send you the some homework for the extra question. So complete your work and send me. Thank you.